Welcome to Season 1, Episode 4 of Beyond Boundaries, the Action Lab podcast, where we are exploring an exciting and intriguing topic that is very relevant in all of our daily lives. That is food and nutrition. We are your hosts, Kim and Robert, and today we've got an amazing lineup of insightful interviews featuring experts who are making a difference in the field of nutrition, food security, and food justice.
In our Faculty in Action segment, we are honored to have Dr. Shreela Sharma. Dr. Sharma is a registered dietitian, professor, and vice chair of the Department of Epidemiology here at UTHealth Houston School of Public Health. Dr. Sharma is also the director for the Center for Health Equity at UTHealth Houston School of Public Health and the co-founder of Brighter Bites. Her work involves behavioral epidemiology, primarily focusing on food insecurity, obesity prevention in children, adolescents and their families, and health disparities research in low-income minority populations. We are very excited to talk to her about some of the amazing work that she's involved with.
Well, if not for anything else, it's such a treat I feel like I'm having a reunion here with you guys.
So, Dr. Sharma, we always start off with this first question of every guest because it gets us an understanding of how we all come to public health, right? So our public health origin story. And so our first question for you today is, did you choose public health or did public health choose you? And tell us a little bit about that.
Sure. So I'm actually clinically trained as a physical therapist and a dietitian. And so I've definitely been on a journey, and I realized through all my clinical training that a lot of the disease conditions that we were working on were preventable. And, I distinctly remember I was at the Institute of Rehab and Research doing one of my rotations, and there were traumatic brain injury, spinal cord injury patients who were there because they didn't wear a seatbelt while they were in the car, or they were drinking and driving and had a motor vehicular accident. And so, and then these consequences last, a lifetime. Smokers who had a stroke. And so I distinctly remember thinking that I want to be in the prevention side of things, but I didn't know clinically, how do I do that? What does that mean? And so I just started exploring, I think all of the work that we do, there's personal support that comes with it. And I was very grateful to my husband at the time. Well, he's still my husband, but at the time, he said, just take the time to explore and see where you land. And so I remember coming to the School of Public Health at UTHealth, where I graduated from, and actually going from one department to the other, just trying to learn about what's happening, what are people doing. And I remember meeting Dr. Susie Day at the time. She's retired now. And talking to her about epidemiology, and I felt like I was home. And that's what brought me to public health. So it was definitely from a lens of clinical practice that made me jump into the very strong desire to do prevention research that then ultimately led me to the School of Public Health.
That's so awesome. And you've been here ever since. I did not realize that. That is awesome. So that says something good about our school and our institution.
For sure. I think our school is special for many reasons. Faculty such as yourself, Kim, our students definitely are what keeps us going, right? But I think I remember I wanted to come back here as faculty because of our statewide footprint. And that is really, I think, really unique to our school, is that we are not just a school with, campuses around the state. We actually collaborate. We have students across these campuses. We collaborate. Some of my strongest collaborators are in Austin, So, and that allows us from a public health standpoint to have that broad footprint, build an evidence base that is statewide, and then inform policy. All of us, of course, ultimately want to inform policy, but really, do that work that pushes policy, because we have a statewide footprint. So that was a big reason for me to come to the School of Public Health to pursue my career in academia.
That's awesome, Dr. Sharma. I feel like I relate with you so well on that, like how public health found me through nutrition and the prevention side. So that's great. And I'm still at the institution myself too. So
We're never going to let you go.
Yeah, I don't plan on leaving. So for our next question, can you share something about your current work that really excites you? What are you doing and what impact are you working towards?
Yeah, Fatima, you can relate to this so much. The work that I'm really fired up about at this point is how can we get healthy food to be a covered medical benefit. We live in a state right now as a country where 90% of the healthcare costs, the healthcare dollars, they go for medical care of diet-related chronic conditions. 90%. We need some of that money to go to prevention work. And we know, all of us, how many of us eat? We all eat, right? We need to eat to live. And we know the importance and the relevance of food to health, and not just physical health, mental health, and just maintaining life and living, healthy and so to me, it seems imperative that some of those dollars actually go to prevention, and the role that we can play at the School of Public Health, and also just a broader public health space, is really building out the evidence base where we can then prove that these forms of interventions, they're largely called food as medicine type of interventions, like produce prescription programs, medically tailored meals. They've gained a lot of popularity, which is great, but we really need to build out the evidence base so that then we can ultimately inform that policy change. So I know we have work to do in that space, but that is what I'm absolutely fired up about. And the timing for that work is really ripe, because there's a lot of federal mandates, through the Center for Medicare Medicaid Services that have come down around social determinants of health. So health systems now have to screen and report on social determinants of health for their patients. And one of those is food insecurity. And so, which we all know is very closely related to eating healthy as well. And so we know that there are policy supports from the federal level to really move us in that direction. And how can we leverage that, right, to get health systems, to get the community organization, and to get our patients to connect all those dots and push policy change so that we can have healthy food to be a covered benefit. But I think of the world in which you go to Walgreens, right? And if you're a patient with diabetes, you get your prescription for metformin, perhaps, and then you also walk away with a box of fresh produce, which is part of your prescription. And wouldn't that be wonderful? And all of that is covered under our insurance plan, because
Absolutely.
the patients who are struggling the most with these health conditions are also the ones who cannot afford the healthy food. So that's what I'm fired up about.
That's so exciting. I'm just so glad we have you today, and really for this episode that will come out during Nutrition Awareness Month, right? And how much of this conversation, I think the work that you're doing is really setting a model. And it's so amazing that it's happening here in Texas for so many reasons, right? And so you're talking about food as medicine, and when you said something around those folks who maybe
dealing with complications of diabetes, heart disease, all these things. And we know many of those folks come from marginalized communities where there's limited access to food. However, historically, many of these communities have a very deep cultural appreciation of like their food history. And so, and the fact that we're in Texas and Houston, such a diverse community, could you share a little bit about like the richness around that and why that piece is so important in the work that you do?
Let's just be really clear. Nobody wants to eat a sad salad because it's healthy. One of my students used to say that, Wes McCorder, so I'm quoting him, but culture is such a major part of food. We celebrate our culture through food, right? I mean, look at who's on this podcast. All of us, have and enjoy and celebrate the cultures that we come from, and we have to be successful in this space. That is absolutely the lens with which we have to come to the table, even in developing these food as medicine interventions. So the work that we're doing is, I would say, design, supporting implementation. So there's an implementation science type of a backbone, and then evaluation. But your evaluation doesn't matter if your design is not, human and culture centric, right? So very much our patients and our even our providers are at the table as we're designing these interventions to start with. We also need to take into consideration, there's the culture context, but there's also the patient's environmental context. One of the biggest barriers to food insecurity in Houston is transportation. It's, it's not food access, it's transportation, right?
Mhm.
And so, we're doing some work right now with high-risk pregnant moms, asking them to go to the grocery store 2 times a week and get your fruits and haul the 30 pounds home. It's not going to work, right? So some of them may need bed rest, right? So we have to meet our communities where they're at, when and where they need us to meet them. And so that is very much the lens with which this work even has any hope of being successful and sustainable. And, all you have to do is, talk to our communities. We are part of the community, right? And you'll be surprised how astute everybody is, and really can help bring the strongest approach possible to the table. So that's definitely, I really appreciate that question, Kim.
Yeah, absolutely. I feel like the awareness portion is so important to recognize all of the various and diverse needs of the communities and to meet them where they're at. Like you said, it's so important for any of this to have any hope to be successful. I think you and your team are doing such a great job. I've been kind of seeing the progress since I joined the institution X number of years ago, and it's gone a long way. So I'm really excited for all the work that you're doing. And I really see that it's making a huge impact. So way to go. And I think now our students at the university and soon to be alums like myself would want to know how we can support this amazing work that you're doing and how we can be involved. So if you could share a bit about that.
Yeah. We are in an institution, and thanks a lot in part to the leadership of people like Dr. Baker, that really puts our student engagement at the forefront of public health work. We are not just about, research or doing things, that we are about public health practice. We are about education, and we are approaching our work, at the Center for Health Equity and the Food as Medicine space in the same way. And I don't think there's a single project where we don't have students at the table building our work. So, and I have to say something that is 100% true for all of us faculty. We actually learn more from the students at times than we can maybe ever teach them. And so it's not just that, oh, here's a GRA position. It's the lens and the lived experience that the students also bring to the table that is really important to inform this work. Our students are many a times boots on the ground to do this work. So there are eyes and ears, right? And so it's really a cornerstone of the both public health research and practice work that we do. So I'll give you a few examples. Like I said, of course, there's the GRA type of positions that our students work in. They also do a lot of practicum work with us, and that is because majority, if not all of our projects are in partnership with other organizations, community-based organizations, other health systems, and coalitions as well. And so we really enjoy building out some of those practicum opportunities for the students and create opportunities for networking through that space. One of the exciting developments that Dr. Jemima John, who is a faculty in epidemiology and part of our center, she is building out a health equity fellowship for the summer. So hopefully, starting this summer, we are going to pilot it. So we'll see kind of how it goes, but creating a paid fellowship opportunity for our students to do health equity work and engage in health equity research and practice over the summer will be something that we will be launching as well. So that's very much still, it's still in inception form. And I hope Dr. John is okay with me sharing it publicly. But we are very, very excited because it's really the hands-on experience that our students also need to then function as proficient public health professionals once they graduate.
That is exciting. So kudos to Dr. John for that work and the Center for Health Equity and
He's
all y'all.
amazing.
So that's amazing. And just for you all who are listening, just to connect the dots for you all, our other guests for this episode, we did not plan the connection between Dr. Sharma and Miss Ivy Walls of Ivy League Farms. But you will hear in Ivy Walls' interview, she mentions working with Dr. Sharma and meeting her and the connection and the necessary work that needs to happen to transform public health, right? And this connection with community that Dr. Sharma is sharing about her work. And so the fact that that kind of aligned in this episode, we're so grateful for that. And then we hope that our listeners and folks who are wanting to know more about the work, students who are wanting to know how to get involved, understand that that is very serious work for us and at the school. And so we're just excited that we can share much of that. And I think also something that Dr. Sharma, you mentioned about how we learn from students. And so you students out there, like, step into your power, step into it. Right? When you want to apply for fellowships such as what's happening and what's building over at the Center for Health Equity and the Action Lab, show your leadership. We are waiting for you all to do that. So thank you so much, Dr. Sharma. Our final question would be to get your perspective on how we transform public health and whether that's, in your opinion, at a global level, federal, state, local. What are your thoughts?
I think that's a great question. I think that transforming public health requires a concerted effort on building partnerships. We don't have to be everything for everyone all the time. There's a lot of great work going on, whether it's in our region, at the state, nationally, or globally. How can we leverage that work and build those connections and collaborate? And it's not collaboration as long as it's on my terms, right? Collaboration requires power sharing. Collaboration requires some relinquishing of control, but the magic happens when you do that, because everybody then, align, like all of those dots come together, and that's when you can move the needle, because you're leveraging each other's strengths. And so, to me, given where we are in public health, we have an incredible amount of work to do, given climate health and social determinants of health, structural determinants of health. There's a lot of work happening, work to be done, but it can only happen through very concerted and thoughtful collaboration and partnership. So if you ask me, when we're reviewing grants, there's an innovation section, right, that we all have to rank and grade. And to me, I want to see innovation through collaboration. I really feel that if we are to achieve something that's bigger than each of us, then that's only going to happen when we, come to the table with that lens and build out those partnerships. And that's what excites me about this space. And also, we just will not be successful in the challenges that we have today, right? The challenges we have today are going to come only through partner. And when I say partnership, collaboration, I'm not just talking about institutional partnerships. I'm talking about partnerships and collaborations with the communities themselves, right? What did we learn from COVID? We learned the unfortunate power that misinformation and disinformation had the lives that were lost as a result of it. And so, we need to have our ears to the ground. We need to make sure that communities are engaged and part of our solution. So that can only happen through that partnership lens.
Yeah, definitely. Teamwork makes the dream work. And, this is what we learn in community-based participatory research as well, like bringing the communities in. Really, that is where you find the best solutions as well. So I think it definitely is how things work best, finding their needs, maybe finding the best solutions, and then using pooled resources to actually get work done. So I think definitely agree
Can I
with
say
that.
something to that, though, Fatima, just real quick? In community-based research, I'd like us to also push that one step forward, that I would like us to see communities at the table to help develop the questions that need to be answered. Many times in research, we write the grant, get the money, and then we're like, oh, let's engage the community now, right? And maybe that's not how the community wants to be. That's not how I would want to be engaged as a community member, right? I want someone to ask me, well, how do you, what do you want to see done? And
Right.
so I think even in research, I'd like us to, we're in public health. The word public is in our work. And so I'd like us to think about what does that look like from just even developing the questions that need to be answered. So I appreciate you calling that out.
Awesome. Thanks so much. Before we hop off here, is there anything we did not get to ask you that you wanted to share with us and the audience today?
I just want to say that I'm always, I just want to share with the students that it's really incredible the amount of student opportunities that are at our school. And I know, Kim, your office does a fantastic job of putting those to the forefront, but I would encourage our students to really lean in. I mean, there's so much happening. Just really lean in, reach out. If somebody doesn't reply to you, reach back out. People, like, many times I'm not in front of the computer. I'm in meetings or other outside, and so I think students should not hesitate to just lean in, and to your point earlier, just step into your power and step into the work that is being done, so they can avail of all of these opportunities that are at our school, which are really incredible. I mean, you've been in many other conversations with other universities, and I feel that our school offers above and beyond the opportunities to engage in both research and practice like no other across the state. So I just wanted to end on that note.
Thank you. Thank you. Thank you. We wholeheartedly agree. Students, you hear that. Please take note. We are counting on you and waiting for you at the table. Thank you so much, Dr. Sharma, for sharing your words today and your time. And we so appreciate the work that you are involved in and what it's doing to better public health.
Well, thank you guys so much, and happy National Nutrition Month.
Awesome. Thank you.
Thank you.
Next, we have our very exciting Community in Action segment. For this segment, we're joined by Ivy Lawrence Walls from Ivy Leaf Farms. Ivy is a trailblazing agriculturalist deeply rooted in community and culture. Her dedication to fostering food-secure ecosystems has propelled her to the forefront of the farming sphere. Based in Houston, she led the creation of a community farm in Sunnyside, one of the city's oldest predominantly Black neighborhoods. With a heritage spanning 3 generations of farming and an entrepreneurial drive, Ivy champions food accessibility and equity. Her ventures include Ivy Leaf Farms, Fresh House Grocery, Coogee Kitchen Restaurant, and Black Farmer Box, which is a weekly subscription service providing fresh produce. Ivy's transformative work is reshaping agricultural landscapes, particularly within Black communities.
Welcome back to Beyond Boundaries, a podcast out of the Action Lab at UTHealth School of Public Health. We are so excited. This is the first time that we are on site for one of our episodes, and we're here at Ivy Leaf Farms, and we would love to introduce you to Miss Ivy Walls.
Hey y'all.
Hey Ivy.
Thanks for coming. Hey, thanks for being here. Welcome to the farm.
Thank you. Thank you so much.
Thanks for welcoming us.
Of course.
And so we're here today to learn about Ivy Leaf Farms and all the work that Miss Walls is doing, what brought her to this work, why it's so important to think about food security and the food ecosystem and what that all means for public health. So we're just going to get right into our first question, which I'm super excited about. And with our first question too, we learn a little bit more about our guests. So we'll learn a little bit more about you. But the first question that we ask every guest is, did you choose public health or did public health choose you?
Public health definitely chose me. I didn't know what public health was when I entered into undergrad. But by the time I left, I was highly interested in just population health and the health of our community.
So to talk a little bit more about that, I'd love for the viewers to know about how you went from public health education to owning and operating your own farm with programming and all of that, and that world that you had in between then and now.
Definitely. So after I graduated from Prairie View, got a biology degree, I got hired as a CDC PHAP, which is of the Public Health Associate Program. So it's a 2-year program where they station you all over America, but I somehow ended up back in Houston, where I'm from. So I got to move back home and work in at the Department of State Health Services. So I was working off Polk Street, and we were taking in any gastrointestinal illness that was happening in all of the counties, surrounding counties, and really calling folks like, hey, what did you eat? What do you think happened? So gastrointestinal illness. Then I moved over to tuberculosis. And so we had a large outbreak that year that I ran data analyst for and had to collect data with high schoolers, which is interesting. And that's where I really learned the intricacies of how disease can actually move. And high schoolers are interesting with who's dating who and who spent a night over here. And so we had to figure out the whole timeline of how this tuberculosis spread throughout this high school. So that was where I fell in love with the idea of how connected we are as humans, no matter where you are, where you're at in the city, how easily your interaction can change your life. After that, I moved over to Memorial Hermann as an infection preventionist. And that's where I really honed in on what happened before the report, right? Or how can we prevent hospitals from getting patients sicker and, preventing infections inside the body. And so started in 2018. By the end of 2019, we were like, what is this? What's happening? I was working at Memorial Hermann Southwest. So it's the most diverse hospital of our city. And it was after Chinese New Year. It was coming around. There were patients in their bed just shaking, right? And we didn't know what was happening. We didn't know if we had to wear masks. We didn't know if we needed negative pressure. We didn't know anything. So we really had to find a solution to a problem that we did not have all of the answers to, which is a lot of public health, right? It's like working backwards completely. Like, you know what's happened, but how did we get here? And what do we not want to repeat to do it again? So that was really rough on me mentally. And so my COVID bubble was my family here at the farm. And oftentimes I couldn't even interact with them because I had been in the hospital. And so I was like, I can't balance my own personal safety, my family's safety, and the mental load of having COVID multiple times and also while still working. So I was like, I got to come back to the farm. Looking at the data that they recreated, Sunnyside had it was alarming. Like, we were reporting so many cases of COVID out of Sunnyside, out of South Park, out of Black and brown neighborhoods. And I was like, why is that? And I looked at my neighborhood. We only have one grocery store. We only have one CVS. We only have one of everything. So the first thing they tell you is to get your groceries, get your medicine, and go home. But if everybody's getting their groceries, getting their medicine, and going home, everybody is sharing this high-touch surface area. And so I only did what I could. Was like, hey, I'm going to grow some vegetables. I'm going to start sharing them with folks as a way to, like, alleviate some of that pressure I was feeling. And then I opened my eyes and I was like, wow, this is a public health issue with the lack of food quality that we had. Because I had the privilege of, still driving back to Pearland or driving to the new 3rd Ward HEB. And I was looking at the people walking, right? And I was like, so how do we create a solution with this problem? And so, long story short, I started growing more vegetables. And eventually linked up with other farmers here, and we created Black Farmer Box, which was a way for us to get our produce to the hands of communities while also supporting Black farmers and ranchers in the city. And from there, we opened up Fresh House Grocery to do the neighborhood aspect. So we were able to touch on Black and brown farmers and producers, as well as touch in our Black and brown neighborhood.
What are you most excited about with the work that you're doing? After we heard from your transition from public health to being kind of in your own space and bubble, but then recognizing this need that has now grown into different entities and in partnerships, right? And so what are you most excited about your work?
I'm excited about my partnership with the Houston Food Bank and Feeding America. They have some really excellent programs to help purchase produce from producers that in turn goes back into the pantry. So not only are producers able to get their products sold, they don't have to do the extra step of finding a community need, finding a place to keep it refrigerated. So the food bank being able to offer that resource and then turn it right back to the pantry, it can streamline it so that we can grow more food. I'm also excited that the weather's better. I'm gonna cross my fingers. We've had very manageable weather lately. The last 2 years, we've had freezes, droughts, hurricanes, floods, you name it. And so I'm really excited about the weather this year and this partnership and developing, this connection from food to community. I firmly believe that urban agriculture is the way that we can alleviate the issues that might come with climate change for under-resourced folks. I hate that word. But, climate change is urban agriculture is how we protect those from climate change.
Would you mind telling us about urban agriculture and what that means, and how does Houston fit or not fit into that mold?
Definitely. So urban agriculture has a million definitions, but I would like to define it as a lot or a place where you grow food, vegetables, or any type of product for the consumption of others inside of the city limits. Houston is an interesting city in the sense that we are in the state of Texas. So we are very cowboy, cowgirl, rodeo season, but we do not have urban agriculture tax valuations or the system in place to actually support agriculture inside of our city. So usually when you see big farms or you see people at the farmers market, they're coming out from Austin inward because they're able to, you know, have these business enterprises because they're getting valued as agriculture, from land valuation to, you know, their tractors, their trucks, all of these things are valued at a point where they can sell vegetables as a product. 18-cent, you know, onion doesn't pay the bills, right? Yeah. So if you're not able to produce enough to support yourself, then you can't create a business. So what I would say is Houston has a lot of homesteading activity. You know, you see the folks on their horses, the folks, you know, you might see cattle in some random lots, but they're not actually being protected enough to keep that up. And that's why usually you see that land turn into development of some sort or commercial type of business. I would say we have a growing farmers market community going on. Like you can go to Rice Village Farmers Market or the Heights Mercantile. Urban Harvest has some amazing markets around the city. So I would say that people love agriculture, but we're not supported in the sense from a policy standpoint.
So as I understand it, here on the farm, we are in the space where you facilitate a lot of the educational training opportunities and programming. Definitely. Can you tell us a little bit about what you have available here?
Yes, so right now we're in our education classroom. So this year we'll be doing some poultry classes. As you know, that you can have 6 chickens in your backyard in Harris County. So we're going to be teaching more about poultry and how do you raise chickens for eggs and meat in your own backyard. So we're really focusing on the backyard farmer. We know that not everybody has acres to work with. So how do you grow food and grow proteins and all of that inside of your backyard? So we're doing that here. We have quite a few folks who are experts who will be teaching on that. Spring gardening is coming up, which is my favorite time because that's tomatoes, cucumbers, and peppers, and all of the good things that make like the perfect summer salad are coming. So teaching spring gardening classes and really opening it up to any other organization that is interested in, you know, the connection of food to health and community.
So tell us how people can get involved. And so with Beyond Boundaries in our podcast, we have several alumni, students, as we mentioned, and faculty eager to know like what's happening, how can they be placed in such initiatives to kind of help support. What are some things that you think folks can help?
Definitely. Here particularly, we always need help weeding. So there's that grass needs help.
Needs help weeding, yes.
Yes.
Come on.
Also just, you know, finding data-driven solutions is the biggest part. I know what I feel and I know what I can do, but how are we determining success in this work is a very hard scale, right? Is it getting vegetables to someone? Does that change their life? Is it access? Is it, you know, education through cooking? You know, so there are so many different aspects of food, right? And then how that goes into the health of a community and health of a person. So finding data-driven solutions. So anybody who has any ideas, I mean, we can bounce our ideas together. This is the perfect incubator, you know, for just whatever, right? Because we can grow food, we can, you know, bring community out. We have space and opportunity. So I would say that. The second is come visit Fresh House Grocery, which is the grocery store that we established. See what we have to offer and, you know, drop education tools. We partner with the American Heart Association. They've given us plenty of recipes and, you know, different types of activities. So any information, like, you know, we will pass it out. I would love to be a great resource for that. I don't know. Y'all tell me. Like, how y'all want to help me? How can we make this a symbiotic relationship so that we can really grow.
Yeah.
Figuratively.
And literally.
Fun.
Yeah, I love it. I love it.
You started off your public health journey talking about gastrointestinal illnesses and tracking that on the back end, right? So you're dealing with all that data on the output, right? People already got the disease. You're just trying to figure out how they came in contact with it. Now you're dealing with training individuals on how and what to grow, to consume. And so now you're on the front end of some
like
diseases and food, right?
Yeah, Food is Medicine is a great program. That's American Heart Association as well. I just got honored by the American Heart Association with Dr. Sharma, yeah.
Okay, yeah.
Yeah, so that's really excited about that work. Like, that's really, really cool work. U of H did a study where they actually went into grocery stores and they tested the salad mix and they tested different types of leafy greens in high resource neighborhoods and under resourced neighborhoods, and they found higher levels of gastrointestinal illnesses in the salad mix, right? And so when you talk about like that piece of like, we're really starting from the beginning. How can we promote self-sufficiency? Because in the grand scheme of things, under resourced neighborhoods will never get the priority or the first cut, right? So if you can give yourself and your family the first cut, you can protect your gut and you can protect, just your sense of purpose in dealing with your food. And I find that when people take more pride in the carrots that they've grown, they will eat the carrots that they've grown versus everybody has a bag of salad sitting somewhere in the back of their fridge, right? But if you picked it and you're like, oh, I'm going to make this beautiful salad myself, right? So you're going to eat the vegetables. You're going to eat a more forward diet if you're involved in the food process, right? Like you usually eat the food you cook, but you will eat the food you grow.
Yeah. It's just so interesting to me to hear your very much epidemiologically focused professional beginning and how that has really kept on through, whether you saw the connection or not at the beginning as to where you were going, where you ended up.
Yeah, that's I tell I just stand and breathe. Like this is all of the things that I've learned to get to this point. I'm just here, right? And trying to drug my brain with those skills because I honestly think public health is the center of everything and we all know that.
We know that. We try to explain it to other people. They don't believe us.
Like this is at the core of it all. Like, public health is what holds the world together. There were some really great, I encourage folks who are interested to look into the PAP program from the CDC. You don't have to have any skills, right? Like they're looking for folks who are just graduated out of their master's program or out of undergrad. And, some people were placed in Guam, some people were placed at the airports. Like they were placed all over and there's so many different types. And that's where I also learned wait, there's somebody at the airport? And it's somebody has to be at the airport because, we have to quarantine people and then zoonosis, they have to quarantine the animals, so there's some really, public health is really the framework of everything.
Put that on the shirt.
Yes, at every point. And so I really am glad to still be a part of it in this way and to partner with amazing organizations like Feeding America, American Heart Association, UT School of Public Health, just all of it is has been enriching, right? And I look forward to all of the partnerships to come.
No, that's awesome. And one of the questions that we usually ask is one of our last questions sometimes, but you're the embodiment of the answer. I'm still gonna ask it anyway. Though. It's your opinion or how you see public health needs to be transformed. What do you think we need to do locally at a state level to transform public health? And I'm going to pause because she's doing it. So in my opinion, you have went into a traditional public health career, paused,
and we're here.
Yeah.
And you are doing things that is working to transform public health. So what do you think is still needed, necessary, and next?
I can give you that answer.
Come on.
It's a little controversial.
It's okay.
We have to be committed to the solution and not the program. I find that when we write grants, it's theoretical. It's all theory. How we determine that success. Sometimes people are pushing money into programs that are no longer actually community driven.
Yeah.
And the theory has already been debunked. So holistically, be committed to the solution and not the program. I think that's really one of the issues with public health, especially in the food space. Because it's easy to be like, oh, well, you know, heart disease, you can list all the things that happen to Black and brown communities here in the city. That is the data, right? The program may be, I'm going to get you vegetables, I'm going to drop them off weekly, right? But that changes nothing in the scheme of like, if that person, we can't just over-educate people into health.
Yeah.
You know what I mean?
Yeah.
So we need to focus on systems change. And so what I tell a lot of people is food is a public health issue, right? We are all food insecure until we have figured out a system where you can meet with a local farmer or you have a local production in our area. Last year, the borders were shut down. Greg Abbott shut the borders down. Trucks couldn't get through. So we felt that at the grocery store. We felt that, you know, getting any kind of product, you know, it was literally rotting at the border. Prices went up. Eggs went up $7. You know, that may have not been our breaking point, but it could have been someone's breaking point.
Absolutely.
Right? And so we are all food insecure until we can figure out how to securely back our diets with production, because, you know, we overconsume as a society. But, you know, that's really the biggest thing I would want people to know is, just because you can make your way to H-E-B or you can make your way to the grocery store does not mean at any point the food there will always be affordable, and therefore you could potentially become insecure. Food access is another thing as well. So food insecurity, food access. Our neighborhoods are vertically integrated, so you might be living next to someone who's making top dollar and someone who's not making top dollar, and everybody still lives on the same street. So in our neighborhood, access is an issue to all, not a certain demographic.
And that's a thing. But it's like there has to be this cultural shift in the way that we see food, or the way that we consume, or the way that we commune.
Yeah. I believe that we're just too far away from grass. I mean, there's too much concrete in the sense of like you forget that lemons come off of trees, right? Or, you know, what you're eating was once a thing. Someone had to grow it, you know, and that is attached to a system and to human labor to our plates, right? It's not the chef. It is not the, you know, the cook that brings you food. It starts at the farm, at the seed. Everything has come from a seed at one point. Who planted it? That usually is the least paid person in this system. So as a culture, I think we just need to remember where food comes from. Like, you know, we're about to celebrate rodeo season. Like those cows are burgers, right? You know, those pork chops, that turkey leg, that was, those had to be raised up, you know? And that's why I go back to like urban agriculture is a way to, you know, kind of alleviate some of the things that we face, and especially and I speak specifically to Black and brown neighborhoods because that's where I live. That's where I've always lived. I focus on my zip code. I have not tried to venture too far out of that because this is my reality and nothing has changed yet. So until we get to there, we will continue to be here. But and this is like super conspiracy, not really, like, but you know, if we were going to be testing lab grown meats and things, who's first going to be receiving on that end, right? It's really expensive now. So like this is, like I said, super conspiracy. But, you know, if a fast food restaurant was going to adopt lab-grown meat, you know, we're in like high caloric swamps, food swamps. Where is that meat going to go, right? Where are these new ideas going to launch themselves? And it tends to be in our neighborhoods before anywhere else. There's just too many opportunities that if we don't control our food and know where our food is coming from, then we're just going to continue to fall apart.
Yeah.
Wow.
Thank you.
Yeah.
Thank you so much for that.
Of course.
This interview and your time. Is there something that we didn't ask you that you'd like folks to know?
I would think another aspect would be how we utilize nonprofits to do work.
Okay.
That should be done by business, right? So in Houston in particular, we talk about like the fact that there has not been this infrastructure for business in agriculture. Most of those have to turn into nonprofits in order to survive off of grant dollars, the taxation of things. And so if we continue to turn business solutions into nonprofit solutions, then there will never be a framework to actually create inside of our capitalistic society, right?
To sustain.
To sustain itself. So that's one thing that we are Jeremy and I are really honed in on. This is a business. Like the Fresh House is a business. Black Farmer Box is a business, and the only way we can sustain it is through business activity, right? And so I would say that if you know that a nonprofit is coming into a community and it's on a grant, right? And when that grant runs out, there will be nothing to catch it, right?
Yeah.
So I encouraged a nonprofit business relationship, so that when the grant is over, the dollars are still there. Definitely.
Awesome. Thank you for that. You've dropped some major gems in this episode. And so thank y'all so much for tuning in. We're excited about our conversation today with Ivy Walls, with Ivy Leaf Farms, with Fresh House Groceries, with Black Farmer Box.
Definitely.
Like all the things. And so you'll be able to see in the description of this episode all the information where you can link to find out these great resources and the work that is being done here.
Absolutely. Thank you, Ivy.
Thank you.
Awesome.
Wrapping up today's episode is our Alumni in Action segment featuring Sarah Krolsick, registered dietitian, public health practitioner, and a graduate of UTHealth Houston School of Public Health's very own dietetic internship program. Currently, Sarah is the outreach manager for the Council for Health Food Systems, a sister organization of Farm and Ranch Freedom Alliance. Sarah is passionate about culinary medicine, community programming, research, public policy, and school nutrition.
Welcome, everyone, to the Beyond Boundaries podcast by the Action Lab. I am so excited to be here today for our Alumni in Action section. We are here with Sarah, who is one of our amazing alumni. You're going to get to know more about her and the work that she's doing. I'm also excited to be joined by our co-hosts today, some of our current students who can introduce themselves, and then we'll get right into it. Ariana, you want to go first?
Yes, I can go first. My name is Ariana Okwozabon. You may have seen me or heard me recently in our wonderful session with Dr. Baker and discussing her work as Alumni in Action. I am an Action Lab fellow for been so since the June of last year, and now I am looking to get my MPH and graduate from the Community Health Practice Program in May, May of 2024. So extremely excited to hear more about Sarah as an Alumni in Action.
Hi everyone, I am Jiten Kalumalikul. I'm in my second semester doing my MPH in Epidemiology. I'm an Action Lab fellow. I'm excited to meet Sarah, hear about Alumni in Action, what she's doing, and yeah.
Awesome. So I'll kick us off with the first question. And Sarah, we ask all our guests, the same question. And it's an opportunity to learn more about your public health origin story. And so could you please share with us, did you choose public health or did public health choose you? And what did that look like?
Yeah, great question. And thank you so much for having me. I'm excited to get to spend this time with you and to connect with some other UT Health Network members. I am a registered dietitian by trade, and I very much feel like public health chose me, and I feel like it had been trying to sometimes gently and sometimes not so gently like nod me into the public health direction. And it took several years for me to realize that, but I ended up in Houston and got my master's of public health here at UT Health.
Awesome. Was it something when you were practicing as a dietitian that said, wait a minute, I need to lean more into this? And is this what public health really is?
I think it started long before that. So I have a bachelor's in behavioral neuroscience psychology. And to some people, they might make that connection right away with nutrition and public health. And some people might be like, what are you talking about? And so I was very interested in nutrition and culture. And I had been trying to find ways to fuse those and didn't have people near me. And social media wasn't what it was then. Trying to figure out how to make these connections myself. And I was really interested in eating disorders because I knew that disordered eating and eating disorders are often not about food at all. It's about a lot of environmental factors, a lot of anxiety, judgment, shame, all in the way that we talk about food and how those thoughts and you develop these needs to control something because of what's happening in your environment. And so I was trying to piece all of that together. No one was talking about social determinants of health. No one was talking about racial justice or racial equity. So I ended up graduating with that degree and still was trying to figure out, what do I do with my passion for nutrition? Because I knew that most people know what foods are better for them than others, just as kind of a blanket statement. But I knew people weren't doing that. And so I was like, okay, so it's behavioral, why aren't they doing it? And I was trying to unravel all this. And so I ended up taking, when I went back to school for nutrition, I ended up taking every opportunity I could just to share information about different Asian cultures. That's an Asian American myself. And so if I had a marketing project, I would talk about boba tea. If I had an opportunity to present to my class about any topic I wanted, I chose diabetes screening among the AAPI community. And I slowly started to realize I'm not talking about nutrition, but I'm in nutrition focused classes. Like I'm always adjacent to it. I really want to talk about culture and the policies behind that. So I ended up having this opportunity to go to DC for one of my classes. And I felt like that was really pushing me into that direction. I knew I wanted to pursue my MPH after the first time I went to DC, and that's what took me from rural Indiana to Houston, Texas. And so I also did my dietetic internship at UT Health.
That's awesome. Thank you for, sharing your journey. I love hearing about the different journeys that we talk about on the podcast and how things continue to build up on one another. So continuing on that track, we'd love to hear about what work you're doing currently and what about that work is exciting you.
So after my program, I can take it one step further back just to help build some more foundation. I ended up doing the Archer Graduate Fellowship while I was at UT Health, and anyone who has an opportunity to do that, I absolutely encourage them to do that. And so I was working at the Academy of Nutrition Dietetics, and it was a time when we thought child nutrition reauthorization was gaining traction in the Senate, and there are all these new proposed rules coming out for SNAP, or the Supplemental Nutrition Assistance Program. And in my training, my formal training, we talked a lot about nutrients and food groups. And it was so interesting to hear people in those hearings and these meetings that were from public health organizations, that were from religious organizations, from children's advocacy groups. And I just realized how much I really enjoyed that collaboration and people who bring so many different perspectives. So that led me into food banking when I graduated. And so I worked at Houston Food Bank for a while in nutrition education, health promotions, and also digital marketing. And so since then, I've done a little bit of school nutrition, and I'm currently working at the Council for Healthy Food Systems as their outreach manager, which I'm really excited about because I've gotten to look at a lot of different parts of the food system, but this organization is really special to me because I'm looking at it from the agriculture side, from the farmers and the growers perspective, and also reaching out to support them and consumers. And so in my position specifically, I get to help BIPOC farmers succeed. I get to help them grow food that gives back to the community and that contributes to our local food system. And I really hope that this gives consumers an even greater connection to food, to culture, and to the land.
Thank you so much. That was wonderful to hear, like how you were involved, like from such an early on time. So I have a question, like, I'm in my second semester. So as students, how can we get involved in the work? Like if we want to get into like what you were talking about nutrition, what are some of the ways that we can get involved?
I think it's good to consider that there's so many different ways that nutrition looks and that you can get involved. So is it that you're really interested in nutrition research? And I know that there are plenty of opportunities for that at UTHealth. Are you interested in community nutrition and nutrition education? Are you interested in the culinary aspect? Even food service has a nutrition component. And so I'd just do a little research to figure out, are there certain areas of nutrition that spark your interest more than others? And if it happens to be more of the local food system, working with agriculture, I would find local farmers and gardeners, look at becoming a master gardener, going to farmers markets and talking to the farmers there. And then there are teaching farms, specifically in the Houston area. I know we have Blackwood, and then Finca Trace Robles, they are working on a new site, and so they'll be up and running, I believe, sometime this year. But those are, just to be able to look for those resources directly into your community, I think is invaluable.
Thank you, Sarah. I know many students are going to be very interested in the work that you're doing now, especially as you mentioned BIPOC farmers and the food ecosystem. Like that is just kind of like next steps in how we start to transform these inequities that we see and just food access, right? And healthy diets. With that work you're doing, because it's exciting, it's super exciting. What could you share with us? And this is almost like twofold, because as an alum, right, you went through the program, you went through the all the facets of what that meant. You were an Archer Fellow, right, which is amazing. So you have different nuggets and different perspectives and different lenses. What in your current space now do you think we need to transform public health, and in particular, the work that you're doing? Like what is needed to transform and transform student learning as well?
So Dr. Baker knows this, but I was a fellow with the Ukombozi program. And so what that means is I went through a fellowship to become an anti-racist leader. And so that really spoke to me in so many ways in how we approach our everyday work. And a lot of people don't like my answer to questions like these because I think to a lot of people it feels unrealistic. But I feel to build attainable wellness for everyone from a big picture perspective means that we help liberate the most oppressed, because the systems and the institutions need to be rebuilt because they operate in a way that holds oppressed people exactly where they are. And that is a lot to take in, and it's a lot to sit in. So manageable steps that I think will help lead up to that are having honest conversations about our work. Who is it for? Who's it impacting? Holding each other accountable, rethinking what community is, because that is so different from one part of the world to another part. And there's just so much bias built into our everyday operations. And I think it's really important to challenge the norm in academic research and in our policies, so that all the programs and policies proposed will always hold people's stories as well as their humanity in the forefront. And I think what I'm seeing right now is that we lose a lot of people's humanities in the way that we talk about things. So having more compassion.
Thank you so much for sharing that, Sarah. We definitely wholeheartedly agree, like with the Action Lab, and that's really why the Action Lab was started here at the school recently, is to give students an opportunity to learn like how we transform public health in a very equitable and real way, and taking things outside the classroom, but then also pushing our learning, right? And unlearning so many things that are not helpful to our growth and liberation. So thank you so much for sharing that, Sarah. Is there anything that we did not ask you that you would like to share today?
I think one thing I was thinking about earlier was just the power of putting things out into the universe. Work is not my life. I made the mistake of making it my life before, and it will not be that way again. But at the same time, you want work that is meaningful to you, that you enjoy, and that you are passionate about. And so I was looking for a position like my current one for quite a while. And I would kind of reach out to people here and there, but I think for the most part, I kept it to myself because I wanted to find it. And so finally, I decided to tell maybe, I want to say 2 or 3 people. I gave them more specific information than I had in the past because I had a clearer picture what I was looking for. And without a doubt, I think maybe 2 weeks later, they passed on the position that I have now. They passed on the job description, and I applied, and it just, I think it just really goes to show if anyone feels stuck or they're looking to figure out what their next move is, don't underestimate how excited and passionate people are to help other people find work that they enjoy.
That's a nice gem, dropping gems for my alumni in action. I love it. I love it. I love it. Thank you so much for sharing that. So listen up to you all out there, students and alumni. Some faculty may need to take that and sit on that, right? And so thank you so much for sharing that, Sarah. So on behalf of the Action Lab, I want to thank you for joining us today. We appreciate you spending some time and learning more about your work.
Thank you for having me.
Thank you for tuning in to this captivating episode of Beyond Boundaries. We dove deep into the heart of food and nutrition, uncovering essential insights and perspectives that we hope leave you inspired and informed. As we end this episode, we encourage you to carry forward the wisdom shared today, empowering yourself and others to make positive changes in the realm of nutrition. Be sure to subscribe to Beyond Boundaries on Spotify to stay up to date on past and future episodes. Until next time, stay curious, stay engaged, and keep pushing beyond boundaries.